Thank you very much, Mr. Louisi. Good morning to all. I will adopt the protocol that has already been established. Let me start off by thanking the Chamber of Commerce and also congratulating you on your 136th annual general meeting for the Chamber. I think it's very timely that we have this discussion at your meeting today. I really love the topic for your annual general meeting today of adapt, operate, and thrive. I added a little piece to it, safely in the COVID-19 environment, which I think is extremely important. It reminded me of my mother's philosophy of the art of démêler, and I think COVID-19 has really taught us that you have to have the art of démêler, where you have to adapt, operate, and thrive in whatever environment that you're living in. And I acknowledge that the business community is one of the hardest hit with some of the changes that we had to implement during this time. So I'm hoping that in the discussion today, there'd be more clarity as I note a level of fear, both with the public and within the business community. I will give you a brief epidemic update, go through the latest protocol amendments and explain why, and to look at some of the new issues that's arising and the support through the Ministry of Health as we manage COVID-19. As indicated earlier by Mr. Louisi, a lot of preparation has gone into the early part of COVID-19, and looking at our indicators from a public health standpoint, our philosophy from the Ministry of Health is really one of learning to live with COVID-19, creating an environment where we expect and anticipate new cases coming in based on our level of risk. And we are at a position where we manage the cases with trying to have minimum interruption with our other sectors. So that is how we have been trying to manage as we move through our second wave. So as of today, the rest of the world has noted more than 53 million confirmed cases. And unfortunately, the second wave is the rate of increase of the second wave is a lot faster than the first wave, which countries went through. The number of cases reported globally continue to rise, over 4 million new cases every week and in the past week. And also the global increase in deaths has also grown by up to 11% in the last week, with the European and American region being the main areas that are affected, which are the areas which would affect us. And even on a regional basis, most of the islands are now going through their second wave. We've noted a total of 226 cases in total. We have 116 active cases managing. We have had 2 deaths and in a total of 4 critical cases. And at present, we have no one who's critical. All of our active cases are mild and asymptomatic. This is just to give you an idea of the areas that are most critical as of today. The European and American region, you'll notice, are the areas that are hardest hit, and those are our the areas we trade and our destination markets, those that are worst affected at this point. This is our dashboard, which we update every day to give you an idea. We're presently managing in isolation and quarantine. Based on our contact tracing, over 700 persons are being monitored on a daily basis at this point. This is to give you an idea of our curve from the beginning, from our first case. And over the last couple months where we've had our maximums, you notice a very irregular curve. Our rate of increase over the last 2 weeks is actually decreasing now. We are hoping that we can maintain this momentum. And the irregular curve noted has to do with the non-adherence to some of the policies that we have implemented on the ground. Our island distribution, to give you an idea of where we're seeing the most cases by district, and also the incidence rates based on the population numbers of the various districts as well, would be the line that you see there. Just for the regional analysis, I know quite a few persons have been asking as to where and how as well. This is just a summary, so you get an idea of the districts that are most affected, and the numbers and incidents on the map. The northwestern area and the eastern belt were the ones, but we noticed in the increase in the west coast as well. These are the amendments that were made to our protocols for the period November 16th to the 30th. And to give you an idea, the recommendations, what we did was an assessment of coming from our contact tracing process, where we looked at the rate of transmission at various sectors within the society. And we used those to indicate where our highest risk areas were, and they were social gatherings were really our highest risk for transmission, which we noted the number of cases coming out of every positive case, and that was what was used to make the recommendations for the closure. The reality is for us here in St. Lucia, the protocols that are put in place are really put in place in a manner to ensure that even though we have positive cases within our sector, it is put in place to allow positive cases to come in, manage, and not have transmission. But one of our biggest gaps in terms of us being able to see the results from that is non-adherence of those protocols at various services. And unfortunately, our inability to enforce as rigid as we should, it has led to a sort of carte blanche effect where an entire sector, for example, the restaurants and the bars, may be affected when some of them may be adhering and getting good results and some of them are not. Given the exponential increase of the virus, we've had to take measures within very short periods, which I understand would be very inconvenient, but the nature of COVID-19 has led us to make some unpopular decisions which have had the economic impact on certain sectors are affected even worse than others. But within the first 2 weeks that we've put in those restrictions, they are really targeted restrictions at the areas where we note a higher rate of transmission based on our contact tracing process. Within the first wave, I should indicate our R0, that is the rate of reproduction of the virus, was seen below 1. With our second wave, it went as high in the first week as 3.9. We brought it down to 3, but 3 is still too high for every positive case. And the data, it really reflects the lack of use of the protocols in those businesses which we note. I mean, I could flag some of the positive ones like Marcy's Supermarket and the banks where it's properly done. When we do get positive cases, the numbers that are transmitted from those positive cases are very low as compared to when we get positive cases in a bar. And through social gatherings, the number of positive cases we get out of every 1 case has really caused our reproduction rate in terms of transmission to be high. So this is a process that has to be ongoing. It has to be all on board. It has to be in every sector. Up to this weekend, the level of adherence, especially at the community level, is not acceptable. So the rate of decrease that we would expect from those protocols are not where we would like to see it as yet. The restrictions are up to November 30th, so new measures will be put in place from December 1st. The risk factors, just to give you a little bit of a clinical, I won't take up too much, but I just think from some of the new data, it would be timely for you to know some of the risk factors like we've been seeing. Our level of morbidity and mortality, thankfully, has not been as bad as other countries where we would expect 20% of the population to have been severe. At this point, we only had 4. 4 is too much, but we've had 4, which is way below what the other countries are seeing. 4 out of the 226 so far. We've had 2 deaths, which is 2 out of 226. Usually, the number of persons who become critical would be 5%. So by the data, we should have had probably about 12 deaths so far, which we have not. And we have had persons with comorbid conditions get sick and recover well to date. Some of the signs and symptoms which you look for, I think everybody is aware of the signs and symptoms of coronavirus, similar to some of the other respiratory illnesses. In terms of the disease severity and lingering symptoms that have been seen both here locally and in other countries, 80% of persons very mild to moderate, 10 to 15 severe, and 5% become critical. People typically recover after two weeks. Some persons takes up to 6 weeks. We are in the process of reviewing some of our protocols based on new data and information coming out of the rest of the world and WHO, including our discharge protocol. We've been extremely conservative in our management, requiring, for example, 2 negative tests before allowing discharge from our facility. New research is showing that after the 14 days, even with a positive test, we look at the viral load and the recommendation for discharge. But these are things we are looking at given our setting, given our risks. But there's new science requesting a more liberal management. This afternoon we're meeting with COPPER again, and we will be making some changes to the protocols that we presently have. Some of the lingering symptoms that persons that has been seen with COVID-19, and we see it here. Some of our patients start off with a loss of taste or smell, and this is what alerts us to get them tested. Some of the complications that we see in the rest of the world, we've not seen those here. Apart from the pneumonia and the acute respiratory failure so far. Some of the long-term effects that we note. In terms of the business preparation for COVID-19 for certification, I will go through this briefly, as most of you, I know, and I have to commend the business sector for the way they've been able to put a lot of the protocols in place in a safe way, and the adherence to the measures. I know it's a huge inconvenience. I know it came at a new cost, but coming from some of the protocols, and I have to indicate we've produced over 100 protocols for various sectors to facilitate their operation after the shutdown, and those we're continuously tweaking as new information, and also the ease of implementation as well. In terms of the submission of the plan, every business should have an action plan before they open, detailing the measures that are put in place to look at all of the areas of operation to mitigate the spread of COVID-19. That is your processes and measures for physical distancing, sanitation, disinfection, use of PPEs, and also ensuring staff orientation and briefing at the same time to ensure everyone knows what to do and what not to do. Also for employees, employee well-being, ensuring that persons with respiratory signs and symptoms notify their supervisor and stay at home. The work from home policy, separation of sick employees or persons coming into the business place, and dealing with the work from home. And I know that has had some impact on the efficiency, as for some businesses it's impossible. For some businesses it really affects the flow, and also the reliability of workers to be able to work from home, and also looking at traveling and commuting measures for workers coming in as well. Some businesses have been able to use vehicles to reduce the risk of the employees when coming into the workplace. Also the hygiene requirements, which I think most persons are aware, and the physical distancing in terms of how many of your work people can be within a work area, making the work area safe, and also the number of persons who can access services within businesses during the operating times as well. The strengthening of your customer relations as well is one of the other points that had to be looked at closely during this period. Some of the new policies and the issues that were arising based on the new COVID-19 environment. One of them was the quarantine after vacation, quarantine after being in contact, quarantine after travel, be it for work or otherwise. And this is one of the pillars that had not been very clear from the beginning. We've had discussions with NIC, with Public Service, with Labor Department, and with AG's office as well, in terms of persons being on sick leave. And the last we got from AG was that we could not mandate someone to take vacation leave for a quarantine, which some of the business sectors did reach out to us, where if someone is going on vacation, for example, on their own time, and they have to come back in, would they be able to take that time on, because it would be a cost to the company, and added 14 days. And the final that we got from AG's chambers, where we could not mandate someone to take their time or their vacation. So it would have to be the sick leave, which we have continued doing. And also after contact tracing, we provide sick leave for 7 or 14 days based on the level of risk after their assessment in connection with the positive case. So that has to deal with the management of a staff member, as well with a family member either in home quarantine and isolation, and also or in the respiratory hospital. Now the management depends on the level of risk of that person for you within your workplace. If a family member has someone within their household who is on home quarantine, this should not prevent that staff member from coming to work. We've received numerous reports of persons being, businesses taking an overly conservative, and we understand the fear, we understand why some businesses would prefer if they don't come, but we need to be guided by the science. If they were in contact with a positive case, that is that they are in isolation, this person would be placed in home quarantine and not be allowed to come into work. But if it's a family member who's in home quarantine, it makes them a secondary contact. So for all first level contacts, that is contacts who have been in direct contact with a positive case, those persons would be given sick leave to allow home quarantine. But if they're a second level contact, that is they're a contact over contact, those persons would not be mandated to stay home as well. In our risk assessment, we look at a number of factors in terms of direct contact, direct physical contact, distance away from that positive case, the length of time in which they were in contact with the positive case, and also the measures that were put in place. If there was the use of a mask for one or for both, and the period of time that it was used to do the risk assessment to decide who needs to stay on home quarantine or isolation, and also whether or not they were, whether the person was symptomatic, and the period in the disease during which they were in contact as well. Because for every case, we're given an indication of the viral load to get an idea of when the disease would have started. And we usually go 2 days before that for safekeeping as well. So we look at all of those measures to do a risk assessment for every contact in terms of deciding who needs to stay home and who can go back into work. And also for positive cases that we discharge from the hospital, we usually give an added 14 days sick leave, and we do follow up during that period, as it has not been determined in terms of a relapse from the disease or in terms of someone becoming positive after getting 2 negative tests. So far from our information, none of our persons have become positive during the 14 days after their discharge from the respiratory hospital. At this point, based on the number of cases that we have and the capacity, apart from our capacity at the respiratory hospital, we are looking at a second phase where we can allow asymptomatic persons to isolate at home, but this is a risk which we acknowledge given our difficulties with managing even home quarantine presently. So it is of concern considering we are still waiting on the shipment for the electronic bracelets, which should allow us to better manage home quarantine persons and reduce so we'll be able to know in a timely manner if there is a breach in terms of someone leaving. One of the things which I should have explained earlier are the risks that exist for us in St. Lucia as a small country, and where the risk for reinfection and the risk that exists to us managing the waves as we move forward. One of the risks are the high levels that we're seeing in the tourism destination market. As I indicated earlier on a global scale, the rate of increase of COVID-19 in the tourism destination is a lot worse than even during the first wave, and the curve has not reached the peak as yet. It is increasing every single week. It's getting worse, the rate of increase in cases and also the number of deaths. So this is one risk which we note continues to be there from our estimation. It should have gone down by this time, but it has not. So a lot of the measures in the progress of the phase reopening, we have had to remain in cycle 1 of phase 5 because of that, not being able to move continuously as we had planned within the 14-28 day cycle. The second risk which we continue to see is the illegal entry, and those have been very difficult to manage. Our contact tracing team, we get a lot of information on this, but this is very ticklish given that it's persons' family members. They're not, we as health persons, we don't report this information as it's given to us a lot of the time in confidence as to their contacts, and it's a very sensitive one because it's persons' family members who do the in and out for their own economic, although illegal. So it has been one that has been difficult to manage and control. Our other risk is related to the breaches to home quarantine by our returning nationals. This continues to be an issue. Especially now, just based on contact tracing, we have over 700 persons monitoring. It is almost impossible for us to maintain payment to government facilities to house everyone. So we have put in place a system where we have at present 4 inspectors who inspect the homes. This has been very difficult for us to manage the numbers and to allow the home quarantine with the support of the police. Unfortunately, we have had to take persons who breach into government quarantine, and in a lot of those cases, it comes at the cost to government still, although we have a system in place where persons pay, especially since the government's policy is treatment and care, and anyone who is a case or a contact of a case, it comes at the cost of government. So all of those, government has been paying for those even within the paid quarantine facility. In terms of I'll move on. I think I shared a little bit management of staff after the suspect of a case has been detected. If a case is suspect, as I said, because they're either symptomatic or they were in contact with, if they were in contact with a direct case, this is someone who would be placed in 14 days quarantine and would be tested during that period. If it's a positive case, our team would then do contact tracing within the workplace, do the risk assessment as I explained earlier, and indicate who needs to stay home and who does not. I also want to indicate to the business places, I notice an overly conservative stance has been taken by a lot of places where they choose to close. We need to look at sustainable, scientific-based approaches when we're dealing with this, especially my next point, managing stigma and discrimination in the workplace. I think most businesses, and for the smaller businesses, it might be more difficult. They need to look at a model where you have a plan, because it is anticipated that in every workplace or office, at some point you will be touched with having positive persons within your place, but it should not lead to you having to close. And as I indicated before, with the measures and the recommendations that we put in place for the protocols, once these are adhered to, it should not be that too many of your workers are affected and that you lead to a place where you need to close. And we have not been advising. There are certain workplaces that we've had to, like one of the gyms where everything was, they were not authorized to open, everything was just done poorly, almost between the owner and a lot of the members were sick. So we had to, certain extreme cases where it just needs to close because nothing is in place. But for most businesses that we've noticed, even when there is a case and we do the contact tracing, it's not necessary to close your entire business based on that, and we are willing to work with you to prevent that. One of the other big issues that we're seeing now is the stigma and discrimination in the workplace, and also breaches to confidentiality. We've reached a place where COVID-19 can come to all of us, to any one of us. You know, we can all become sick at any point, and we need to, both for education for our staff and our workers, to let persons feel comfortable when those workers have to come back into work without the psychological impact on them when they come back, but ensuring that the safe measures are in place at all times. Some of the preventative measures, which I think by now everyone knows. I think we've said it over and over again, how to protect yourself and others, but I think I have to include it in every presentation so that it's extra clear. We can stay safe and keep ourselves safe during this time. I'll touch a little bit on the treatment. Like I said, most persons are very mild, so supportive care would be required. 15% of persons usually require hospital care, especially persons with comorbid conditions. There is an FDA-approved drug, but it is still in question as to its effectiveness. 5% of persons usually require ICU care, and 2.5% usually from the data around the world succumb. In terms of the vaccine, we are working with PAHO and the other member states. We have already signed up for the vaccine through them. The present cost for the vaccine to the region is 10 US, but we have been able to get it at 7 US when it does become available. The estimate is within the first quarter, so that by March we should have the vaccine available to us. In St. Lucia, we put a planning committee in place because we acknowledge a huge amount of health education and communication would have to go in before this vaccine is even made available to us, and we are working on that targeting and to ensure that accurate information in relation to the vaccine is available. Some of the things we are looking at is, do we make it mandatory as per our Public Health Act with the other vaccine? We're looking at who we make it available to. We're looking at healthcare workers and persons with chronic diseases, our most at risk persons. A number of models that we're seeing, some airlines are now asking that persons have to show that they've been vaccinated for travel. That may start next week. Some countries are also looking at the model where you make, similar to what we've done for like yellow fever and for countries with measles outbreak, do we make it mandatory that persons coming in have to show proof of immunization? So we are looking at a number of models in deciding how we make it available, because we will need at least 70% uptake for it to be valuable for herd immunity. If the uptake is very low, it means we will continue having issues, we'll continue being at risk. So the ministry, we're looking at a number of models to determine what the recommended policy will be on this new vaccine coming in. Our response, just a few, in terms of our healthcare facility preparation, activation of committees to manage. We've developed the diagnostic capacities through the lab, contact tracing and quarantine, protocols for the relevant sectors, and the general measures of infection control for border agencies, etc.